Good afternoon, friends. We're going to have a very important discussion on a very vital subject which happened very recently. Go ahead, Priya.
Good afternoon, doctor. Recent news about 10 deaths in 24 hours during Dasara Garba dancing events is worrisome. Any thoughts on that, doctor?
Yeah, definitely worrisome. See, she's asking about nearly 10 youngsters. They're like ranging from 13 years, 17 years, like 30 years and all, suddenly having an acute cardiac arrest, a cardiac death within 24 hours. And this happened during Dasara, this last couple of weeks back. And they were all doing Garba dancing, Garba dancing is a very active, energetic, very demanding dance. And they were all dancing, and while dancing, actually it's very disturbing when you watch the video. One young guy is dancing, and suddenly he just stops, and then he holds on to his chest, and then he gives you a fainty feeling. He falls down, and then he dies. This is really very disturbing, and it comes with a note. It can be very disturbing. Please do not watch if you have a feeble heart. That's what the warning says. So I was terribly disturbed myself when I watched that. And it is not just one, there are like 10 youngsters ranging from 13 years to 30, 35 years. And that's what Priya is asking me about, and I think the whole population is asking about. A lot of my friends are asking me, Doctor, you need to come with some kind of an explanation. How you see these acute cardiac deaths? Okay. Uh, One thing is, this Garba dance is very demanding. It's a very high energy dance, and people who are not cardiac fit, who have pre-existent problems with the heart, which probably was not even diagnosed, and they could run the risk of sudden cardiac death because there is so much of oxygen demand, sudden surge in the heart rate, and then cardiac ischemia, like the heart is not getting enough blood supply because of different reasons. I could give you one example. A lot of sportsmen, athletes, they have a sudden cardiac death, like somebody is playing football. He just falls dead. How do you explain? Most of these deaths, when they do a post-mortem, they find they may have a coronary osteal stenosis, which means they have a narrowing of the origin of the coronary arteries. These are the arteries, the blood vessels, which supply the heart. See, heart is pumping blood to all the organs, your brain, your kidneys, your intestine, everything. But for the heart to function normally, it needs its own oxygen and the blood supply, and that comes through the coronary arteries. There are major coronary arteries. When the coronary arteries are taking origin, that place is called a coronary ostium. And from birth, some people can have a narrowing in that spot. It's called a congenital coronary osteal stenosis. And many times is only a post-mortem finding, which means only after the death, when they do the post-mortem, they realize that this is the problem they had. And when they were living, they probably didn't have too many symptoms. They just had an acute, sudden chest pain, and they fainted, and they just died. One of our staff actually had that kind of an abnormal finding. She had a heart attack, but she's very fortunate that we were able to kind of suspect, diagnose, and immediately get a bypass surgery done on her on a very emergency basis, and she survived that. She's doing absolutely fine now. And see, this is an example. And the population, there could be more people who have the same problem, right? This is one of the reasons. I was also thinking, any of these dancers, were they taking any drugs? This may sound very cynical, but the fact is, at least in USA, there are people who do all this extravagant dancing thing. They take amphetamines. They are stimulants. They stimulate the heart, they stimulate the brain. It gives you more energy to perform so many things, including dance. you know about like Michael Johnson and so many other people were very famous dancers. They were all on drugs, right? So some other people could be taking some drugs, and that could be contributing to the cardiac death. I'm not blaming these Garba dancers as they were on drugs. I'm just telling these are the possibilities, and youngsters these days are into drugs, many of them. So this is another thing. But the most important thing is sleep deprivation, wrong meals, and just not concentrating on their health generally, and not checking their blood pressure. The blood pressure is traditionally called a silent killer. It doesn't cause a lot of symptoms, no. You know, if you just do a random checkup of the blood pressure, so many of my patients, they say, no, I don't have blood pressure. But when you check, you have seen it, right, Priya?
Yes.
220 over 120, like that, you know, very, very high readings. So they could be having a silent blood pressure which killed them. They could have developed some kind of a cardiac arrhythmia, like the heart rate is not going in the smooth, very traditional, the tuck 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 plub tup plub tup plub tup. This is the normal thing, right? But if the ventricle starts beating very fast, we call it ventricular arrhythmia. Sometimes we call it ventricular fibrillation. When the heart starts going like 300, 400 like that, it is beating very fast. Then that's like an inviting sudden cardiac death. These are thoughts that come to my mind. So many things, I cannot explain the whole thing about sudden cardiac death within 10 minutes. But it's a fact that many of us don't have a preventive cardiac checkup before we do all kinds of things, including dancing and participating in marathon and so many things. That's why some of the marathon runners also, suddenly they die. And recently, we have been hearing about a lot of people dying when they're actually exercising in the gym. I think the Kannada actor Rajkumar's son, what is his name?
Punit Raj.
Punit Raj, very popular, and he was very fit also. He had a sudden cardiac death, and probably because of sleep deprivation and not on the right diet, not checking on the blood pressure, not going through proper cardiac evaluations periodically. These are the things that come to my mind. I'm sure you have more questions, Priya.
Yes, sir. So much concern about the COVID vaccine and sudden cardiac death, sir. Is that true?
Not quite true. See, people have been blaming anything that happened in the health issues after the COVID epidemic. They think that everything was contributed by COVID or the COVID vaccination. But it's not entirely true. I'm not telling COVID is not a contributing factor in sudden cardiac death, because COVID essentially can cause vasculitis. That virus infection can cause inflammation of the blood vessels. It can produce so much of chemicals, what we call cytokines, which we talked about during COVID time. We talked a lot about cytokines. All these things can cause a derangement of your coagulation. Your blood has to clot in a normal way. But if there's an abnormal clotting within your blood vessels, including your coronary arteries, you can have an acute heart attack. We call it myocardial infarction. So, sudden cardiac death. Myocardial infarction is basically like a heart attack. Not like every myocardial infarction should cause death. If it's massive, sudden, if it involves some critical vessels like left anterior descending, LAD, it can cause sudden death. So, COVID can definitely contribute to sudden cardiac death. This was during COVID epidemic we observed. Also, it was causing pulmonary embolism. It was causing clot within the pulmonary arteries, which are main arteries that is, that's going to essentially supply oxygen. Only the lungs have to supply the oxygen to your blood. And then if there is a massive pulmonary embolism, you can have a sudden cardiac arrest. So these are contributing factors. Regarding COVID vaccination, I don't think there is any study that says that COVID vaccination is going to be a cause of sudden cardiac arrest. No, it doesn't happen that way. But COVID can, after a COVID attack, up to 2 years, some people say 18 months, up to 2 years, you have an increased risk of sudden cardiac arrest or sudden cardiac death. So we have to keep that possibility in mind for sure.
Then what is your advice and what are the precautions, sir?
Precautions, I think I went over it before. Check your blood pressure periodically, have a cardiac evaluation periodically, have a sensible diet. Don't go on fat diets, People want to lose weight and then they go on some fat diet, low calorie, no fat, no protein, or a high carb, all kinds of diet, it's available in the market. And so many nutritional specialists and so many pseudo nutritional experts are there advising you or misguiding you in this direction. So, a sensible diet, have enough protein, enough fat, enough carbo, and have divided meals, timely meals, and don't overexert yourself. Don't stretch yourself very thin. Have 7 hours of sleep every day. That's very important. Don't get stressed out. Don't get too much of anxiety, tension, everything built into your mind, and then that disturbs your rhythm. And night sleep is very important. People think, especially these IT people who do a lot of night calls, they think by sleeping in the daytime, they are able to get enough sleep. That's not right, because the night sleep is very essential for your body's environment, the interior environment, to be maintained properly. The hormones, your thyroid, and to prevent obesity, and the melatonin response that happens in the night. All these things are very essential, and people who are sleep deprived at night time, they run the risk of increased gastroesophageal reflux disease, the increased risk of sleep apnea, obesity, diabetes, and so many other things. So all these things, diabetes is a risk factor for cardiac death, hypertension is a risk for cardiac death, and untreated or poorly managed respiratory problems, including chronic asthma and COPD. I have to mention smoking. Smoking is a very, very high risk for coronaries. Actually, people just smoke and they enjoy, letting out rings of smoke, right? I used to tell, my professor used to tell, that every ring that comes out of your smoke is not just a ring of smoke, it's a ring around your blood vessels, it's a ring around your peripheral arteries, it's a ring around your coronary arteries. So you have to be very, very careful that you don't smoke, you don't get into the habit of smoking. And if you're a smoker, once you hear this message, please quit smoking. Smoking can kill you. Smoking is done only by people who don't believe that their children are going to take care of the burial rites. They already set fire to themselves. This is how I would see that. Right?
Yes.
And anything else be left on this? It's very important. I mean, don't get hyped up. There are deaths, sudden deaths. That doesn't mean that every dancer has got an increased risk of sudden cardiac. It's not the message that I want to convey. I want to convey very clearly and precisely that you all have a set rules for your diet, your sleep, your lifestyle, and do meditation. Control your feelings, control your anger. These are very important. And start loving people. Love is an extremely good medicine. If you love people and if you give people, you get a lot of happiness, and that will relax your mind and that will also relax your blood vessels. Right? Anything else, Priya? That sums it
Yes,
up?
sir. Yes, sir.
So, the take home message is watch videos like this given by doctors and don't get misled by people who are non-medical, who give opinions on all the medical issues and then kind of distract you, confuse you and frighten you. Right? Thank you.